Let's order you this one, I do this one, then you,
What can I do? Maybe you do electronic BOB.
Stanley, Owen, Stanley, actually fits pretty perfectly, BOB, you want, and Witters.
And then you on insurance payments, right?
Yep.
And then me on collections. Then you on patient billing and me on patient statement.
Good morning, everyone, and welcome to today's webinar, 7 Things Your Back Office Should Be Doing. My name is Stanley Roca, and I'm Analytics Development Officer here at Avea Solutions. We are a revenue management platform built specifically for the behavioral healthcare industry. A little bit of background on me. I come from a treatment center background doing all sorts of different back office job functions, from intake and admissions, verification of benefits, utilization review, billing, and collections. I have with me 2 of my colleagues here today, Owen Peterson and Whitney Bruce, and I'll let them introduce themselves now.
Good morning, and I'd also like to welcome everybody. My name is Owen Peterson. I'm Customer Success Manager here at Avea Solutions. I focus on adoption of the platform and our clients getting the most out of the services and the functionality that they can. I, like Stanley, come from a treatment background, facility background, working my way up from doing VOBs, to data entry, to wading through paperwork, posting payments, eventually to utilization review, and then to overseeing an intake department for a rather large corporate treatment facility, about 100 inpatient beds and 3 outpatient programs.
Hi, I'm Whitney Bruce, and I'm also with our customer success team. I've been with Avea from the start, and I have a background in both billing and product support.
All right, and without further ado, we'd like to get started on today's webinar topic, 7 Things Your Back Office Should Be Doing. We will go through our presentation, which should take approximately 20 to 30 minutes, and then open up the floor for Q&A after that, questions and answers after that. So, once again, we are with Avea Solutions, bringing you this webinar on 7 things that your back office should be doing. I'd like to start with a brief overview of 7 functions with which to manage your business. You'll see over here a dashboard representation of 7 of the key work processes or workflows that should be occurring in your back office. I'm sure for most of you attending that most of this is already going on, but if it isn't, then you may want to take a look and reevaluate your back office performance. But right here, what we have pictured is a dashboard-driven view, a task-driven view of the 7 key components of any behavioral health facility's back office operations. And we've split this up into 7 categories. The first being verification of benefits and eligibility. The second is utilization management. Third is claim submission. 4 is insurance payments. 5 is claim collections. 6 is patient billing, and 7 is patient statements. Each of these individual workflows and processes or functions are pretty integral to any behavioral health facility's back office operations and cash flow operations. And as such, we do want to have a bit of a focus on operations optimization through the use of online platforms or digital platforms in order to manage these key job functions within your back office.
So what is the big deal? Why move to digital platforms and applications to manage your back office? Paper processes make it far easier for things to fall through the cracks. In 2017, payers are moving away from it. As providers, we should be moving away from it as well. Losing one backroom person could interrupt critical processes and disrupt your workflow. I know I've been in situations where, you know, one piece of paperwork, you got 5 people doing a fire drill, all looking for the same EOB or something of that nature, and just to get the system all ready. Even the most well-organized spreadsheet is still just a spreadsheet.
But what can we do about it? Just because it's always been done a certain way doesn't mean it always should be. A lot of people are used to their old systems utilizing paper billing charts or even paper charts. As we move into a time of electronic health records, so too should we be looking to optimize performance in our billing offices by moving our previous paper processes over into digital processes. Some of the benefits from that are electronic claims management is faster, more organized, and less error prone. Further, we do need to, as a community, keep in mind that some of the major payers are moving toward mandating electronic submissions and remittances altogether. So at a certain point, probably in the fairly near future, paper charting and paper billing could be obsolete practices, and we should be preparing our organizations in order to move into an ever increasingly digital world. Electronic processing also increases processing and turnaround time, lowering days in AR by getting claims into adjudication faster, receiving payments faster, and helps us all move our organizations one step closer to a predictable revenue stream, further realizing the potential of increased operational optimization.
Okay, electronic verification of benefits and eligibility. It's important to determine the right fit for you as a provider. You can't accept everyone with an insurance card. Payers and plans are constantly changing. There are limitations on who you can accept as a provider, so you need to be sure you're making sound decisions surrounding those admissions, whether it be for financial reasons or you come up with a patient who's got a policy that simply will not pay to a provider as you. Save your valuable time. Instant clearinghouse eligibility checks are available. They'll let you know if a patient has active coverage in a plan that works with your program. So you know when to pick up the phone and make that crucial benefits verification call. I've been on those phone lines and I know it takes forever to get through. You don't want to spend 20 minutes on hold waiting to get through to Blue Cross just to find out that it's an HMO policy or an in-network only policy and that you can't work with the patient anyways. It's important to reevaluate verification of benefits on a monthly basis. Plans and eligibility are constantly changing, especially in this day and age with individually funded plans. After admitting a patient, you need to ensure his or her policy is still active and that no benefit changes have occurred. Don't get caught off guard by termed policies or dramatic changes that will affect you or your patient's care.
I think this is especially relevant now as we see a lot of patients coming through with Affordable Care Act exchange policies, which have 90-day grace periods. A lot of times a facility won't even know that a patient is on their grace period if they don't check that verification of benefits or check that eligibility, which could lead to interruptions in cash flow streams if a patient's policy is determined while the facility is not knowing. Part 2 of our 7 functions is electronic utilization management. One of the key components of an effective utilization management department within your revenue cycle management department is understanding payer guidelines. In addition to nationally recognized medical necessity criteria, each payer will have their own specific guidelines as well. Familiarizing yourself with the payers with whom you most commonly work will give you an advantage when it's time to call or fax in a request for additional authorization. As a former utilization review coordinator, I highly recommend each person within that function of your team familiarizing him or herself with the major payers that you work with and their medical necessity guidelines by level of care. This will help to ensure that all patients are able to receive the care that they've come to you for, that they so desperately need. It just revolves around education for your team. It's also important to recognize that every payer is different. And as such, it's important to have processes in place in order to track average lengths of stay for each level of care so that you know what to expect when you're admitting a patient. That way you can communicate these expectations on the front end to the patient and to their families. Project what you will likely be receiving based off of data patterns, which allows you to build a stronger treatment plan and get the most from the time the patient will be under your care. Further, treatment is shifting focus toward care quality. Clinical documentation and utilization management need to be better than ever and need to be more aligned than ever. Integrations between electronic health record and practice management platforms cut down on the time it takes when documentation is needed.
And our third pillar is electronic claim submission. Submitting claims electronically helps expedite the claim submission process. Having all of your info all in one place makes submissions a cinch. You can set up your claim generation to populate electronic forms to input necessary information in all the right places, which will help boost clean claim rates and help you avoid the need to troubleshoot claims and to bridge revenue gaps. It also helps stay on top of coding and claim form requirements. Behavioral health billing features a handful of codes and code combinations to use. Despite this, payers are very specific about how they want things coded and sent. Billing platforms help you adjust and submit claims as soon as you ascertain a given payer's coding requirements. And lastly, it helps develop a better understanding of problem areas. Insurance billing is becoming increasingly difficult to navigate. Get ahead of sweeping and payer-specific changes with these and avoid dips in revenue by submitting claims electronically. Electronic claim submissions also let you know if the claim is rejected by a clearinghouse or payer in a fraction of the time it takes via traditional means.
Number 4, electronic insurance payments. Electronic remittance, or ERA, and fund transfer, or EFT, now make it easier and faster than ever to have EOBs and insurance reimbursements sent directly to you. You no longer have to wait on the mail for checks. You don't have to wade through paperwork. Managing labor-intensive tasks like matching and posting payments to claims is something that's not necessary to you as a provider any longer. There are other options. Consolidating your payments is important. Keeping all payments and payment explanations in one place at one time will help you avoid both revenue and important information slipping through the cracks. You no longer need to rely on overworked employees to track these payments. Get all your information through one channel where it's easy to locate and apply. If you need to appeal, anything of that nature, you've got it all in one place, you know where to go. Effortless collections. Most payers do now accept electronic funds transfer, EFT. You simply set the account to which you'd like payments dispersed and you wait for the revenue to come in. Again, no more time spent waiting for the mail. No need to worry about misplaced or lost checks. Just straightforward direct deposits for your insurance billing.
Our 5th function is electronic claim collections. You need your back office to know where your collections are and be able to identify issues faster. Verifying via software that claims have been accepted and are processing, or alternatively, if claims have been rejected by the clearinghouse or the payer, it is important to keep a pulse on this activity on your claims process, finding out immediately so you can adjust, resubmit, appeal, or fight as necessary. All of these functions are important for your back office collections teams to have as up to date, as up to the minute awareness of, so that you can mobilize your resources faster in a more effective manner so that you can close your expanding days in AR. It's also important to harness the power of software and harness the power of data in order to stay ahead of reimbursement trends and changes. Through robust reporting, you should be able to track payments for specific payers and policies and adjust accordingly when reimbursements begin to dip or increase. If you are an out-of-network provider in a specific area and you've started to see that one of your major payers has dropped their usual and customary rate or their maximum reimbursable charge for a specific level of care that you provide, it may be time to reevaluate your marketing practices or your admissions practices to vary your payer mix in order to account for these dips in reimbursement trends. Identifying underpaid claims will allow you to be able to take more swift and appropriate action, and you should also be able to anticipate potential refund requests. Projecting revenue no longer has to be like reading tea leaves. Electronic claim collections can let you base your expectations on real data in real time. Further, you should be able to specialize your workforce. Put the right people in the right places to monitor and ensure collections are coming in quickly and being allocated accurately. If you have one person that's great with writing appeal letters, have that person fight to maximize your reimbursements.
6, electronic patient billing. There are now digital methods to track patient responsibility. You no longer manually have to do it, total it up, track it, and then go after the patient for it. You can automate it. Electronic remittance will calculate that patient responsibility for you. When manually working claims, the patient responsibility will automatically be allocated to buckets where you can monitor and track what is owed to you as a provider and decide how to pursue that amount accordingly. You can handle any payment transaction securely. There are several merchant banking applications out there now. You can collect deductible or out-of-pocket max with ease upfront through check, cash, credit, debit, and record it where you can easily apply it to a patient account without typical accounting and bookkeeping. Set up secure payment plans, send payment requests connected to merchant banking software. Again, this is more about consolidation, keeping it all in one place, having it all available so that when you go to that patient record, you know exactly what's going on with insurance and with patient responsibility. Pure private pay or billing related to non-treatment related services. Many providers have clients without insurance who are willing to pay for treatment out of pocket. Many providers offer partial scholarships. Sober living is becoming more and more common, maybe even ubiquitous at this point. There are rent and other fees associated with that. There is software out there now where you can collect and track these payments through the same secure merchant banking software.
And our seventh core function, electronic patient statements. Again, this is another area where you can utilize software and automate your back office practices in order to gain operational efficiencies. One of the first ways that you can do that is through statement generation. With either the click of a button or through configured settings, you should be able to automate patient statements which clearly show all patient responsibility and any credits or debits applied to the patient's balance. Your software that you're currently using to track patient responsibility should have automated features in order to make this a much more efficient process and to ease the burden that has been placed upon your back office team on maintaining paper charts for patient billing. Statement printing and mailing. Manually printing and sending statements, making collection calls, sending payment requests. Some of these have previously been laborious processes that required the maintenance of paper patient billing charts and large calendars on an individual employee's desk. Now you should be able to utilize softwares in order to automate most of these processes to make the job easier for your back office staff, to make it more efficient, and hopefully to more efficiently optimize your collection efforts. You can set up automation through print houses in order to have statements mailed out at predetermined times, leaving a lot of the guesswork out, leaving a lot of the need for you to maintain current manual calendars out of the entire process. Through this, you may also remain in compliance with insurance carriers and retain the autonomy to control how you want to collect from your patients. Again, putting the power back in your organization's hands. Further, you should be able to utilize patient statements in order to track outstanding balance and payments made in specific patient billing accounts receivable reports. Get a quick snapshot of what's due to you, how long it's been outstanding, and if any action has been taken by your staff without needing to go to each one of your individual staff members individually. You should have one consolidated place where all of this information lives so that the data is at the tip of your fingers. And with that, we have reached the end of our slideshow. I do want to stress once again that these are 7 things that your back office should be doing, and all of these efforts are really vital to the operational, to the financial health of your organization. What we recommend is harnessing the power of software, harnessing the power of data in order to drive better decision making, in order to drive increased operational efficiency in each one of these 7 areas. And with that, I will open up the floor for questions and answers. All right, looks like we have one question. Ken asks, with recent insurance trends, what area in my business should I focus on most?
So that really depends. I'd say that's more payer specific than anything. It depends on the, obviously insurance trends are trending towards the quality of care as opposed to, you know, volume. In the past, it's been as simple as you submit a claim and you get paid on it. There's an increased focus on clinical documentation, on quality of care, on treatment plans, on things of that nature. So I really focus on first shoring up your clinical documentation, getting your team, whether it requires hiring a consultant or you know, bringing somebody in to talk to them about what these payers are looking for. A lot of payers do have criteria that they post online that you can view, and it's basically getting your documentation squared away and in line with what those payers are looking for. And also understanding what payers are willing to pay and what they're not, because there's simply some things that they just, no matter how you bill it, they won't pay it, no matter how many modifiers you add or you know, what you do, especially when you get to the lower levels of care. It's important to just documentation. It's huge.
Yeah, I think central to that idea is the concept of education and then transparency. One, your entire organization needs to educate themselves on shifting payer trends, on medical necessity guidelines, on what is current industry standards when it comes to billing, when it comes to collection efforts, et cetera, et cetera. And only through having a keen understanding of what is going on in the industry and having your entire team able to see those trends and track those trends, will you be able to stay current with shifting trends. So I'd say one, be able to educate yourself and your team on shifting payer trends, really across all 7 of the functions that we've laid out today. And then 2, instill a culture of transparency and harness the value of data in order to be able to monitor and track those trends and anticipate any future changes.
Okay, and it looks like we've got a question from Greg. What are the best practices for switching over to electronic claim process that won't interrupt my revenue stream? So with any digital provider, there will be different options. You can do it quickly, you can do it slowly. What we recommend is a slower approach where you transition into the electronic claim process. You get enrollment set up. Again, ERA and EFT is available with nearly all providers. Get those enrollment forms out there, get the registration started. You can continue with your old practices and then slowly transition, and I think would probably be the best approach.
It's important to understand that this is a rapidly changing landscape, and it's tough to change all of your practices all at once. We've seen our clients have the most success when they do things in a phased approach so that they can get used to new processes, get used to new trainings, get used to really a new way of thinking entirely. What we've seen is huge gains in operational efficiency and gains in insight and gains in really preparedness to be able to weather the storms of whatever insurance payers have to throw at providers. So I have to agree with Owen there that taking a phased approach is what I've seen be the most effective. But really what it comes down to is being able to educate your staff, educate your organization, and be ready for what comes next.
Yep. As we said earlier, there's only a handful of codes in behavioral health to build, but it's becoming increasingly difficult to navigate those codes and to operate efficiently. We recommend task-based, after a phase-based implementation, maybe a task-based operation or workflow, and then have somebody who's closely monitoring those payer trends because they're coming quick.
All right. Do we have any other questions at this time? Nope, doesn't look like it. Well, I'll go ahead and thank all of you for attending today. For more information, you can follow us at Avea Solutions on Facebook, Twitter, and on LinkedIn. We will be sending out a recording of
this webinar as well as the PowerPoint deck to all of those who registered and all of the attendees. And once again, you can reach out to any of us here at Avaya Solutions if you have any questions on any of the subjects that we covered today, or if you have any other questions in general. And we'd like to thank you for your time and look forward to seeing you on the next one.